Hello everyone, my name is Aaron, and as you know, this is my HIV journey, where I cover everything related to HIV. Today is day 391 since I was diagnosed with HIV on June 6, 2011. So I hope wherever you are today that you are dealing well with your diagnosis. There's a couple things I want to cover this week. As most of you know, the healthcare reform passed, well, not necessarily passed, but the Supreme Court held that it was constitutional. And so what does that mean for you and I that are living with infected or affected by HIV? Well, it means that insurance companies, HIV prior to this has been a pre-existing condition, and so a insurance company could deny you benefits or charge you exorbitant amounts of cash to offset that. So now under the healthcare reform, or as it's also known, Obamacare, it is it does away with pre-existing conditions. So that's great. I know for myself, I currently do not have health insurance. The way that I see a doctor is through a study through Gilead, and that's how I get all my medications. And if I also get sick, there's also some other programs that I'm under. But basically, whenever I changed jobs, I lost my insurance. And so like many of you out there, you're just praying that you don't get sick or that you remain healthy. So, this is one example of where I encourage you, my viewer, to take a stance. And although we hate to be political and we hate to get in that arena, it's very important that we advocate for ourselves and we put politicians in place that have our agenda. And so that's one aspect of it. The ADAP situation with the AIDS Drug Assistance Program is another one. Are your politicians voting in a way that's conducive to keeping these programs alive, to keeping ADAP alive? Missouri currently does not have a wait list for the AIDS Drug Assistance Program, but there are many states that do. So I would encourage you to do some research on that and to find out what your state situation is. And you can go right to Google, type in ADAP and your state name, and you'll find out relatively quickly. It's very important that we fight for our own agenda, because ultimately no one's going to fight for us, right? We have to fight for our own agenda. If we, Ryan White funding is up for reauthorization in 2013. I don't think, it's not going to be fully authorized. I think they are going to do away with portions of that funding. Consequently, that's going to have a negative effect on everyone and all ASOs across our nation. Why is this occurring? It's occurring because people do not think HIV and AIDS is still an issue. HIV is an issue. AIDS is still causing deaths. AIDS itself is not causing deaths, it's the opportunistic infections, but people living with HIV and it progressing. And that brought me to another point that I've never really hit on in my YouTube channel. But there are people out there, HIV patients, who are parents and have children and have families. And if it's a choice between your own medical coverage and your own medications or the well-being of your child, how many of you are putting your children before your own health? That's not a decision that you should have to make. A decision about having a place to live and your HIV meds should never be a decision. A decision about whether your children have something to eat or you have your HIV meds, that's a decision you should never have to make. And I know sometimes I focus on HIV as it pertains to me. I'm a gay male, so HIV as it pertains to me. But HIV is not a gay disease. It's not a male disease. There are females. There are males, blacks, whites, Indians. HIV is not a respecter of persons. It doesn't discriminate. So I think sometimes it's very important to see how HIV is impacting others and their way of life. I would definitely love to hear from you about what tough decisions you've had to make. Maybe you've had to choose, I don't know, maybe you've had to choose housing over medication. Maybe you've had to choose transportation over getting your meds. I don't know. I would be very interested to hear that. Also, we're pushing for hashtag HIV, a global initiative to reignite this conversation about HIV/AIDS. What are you doing? And I've asked it and I keep asking it. What are you doing in this fight of HIV/AIDS? I know what I'm doing. You can click on my YouTube and see what I'm doing. But we all can affect some change. We all can do something. Maybe it is writing your congressman. Maybe it's calling your senator. Maybe it is going to support a local ASO. And I'm going to throw ideas out there, and I'm going to keep throwing ideas out there, because HIV/AIDS is not past. AIDS is still here. HIV is still here. We have people who are still becoming infected. We have people who are still getting sick. And unfortunately, we have people who are still dying. Yes, the numbers have decreased, but until that number is zero, we have work to do. We have work to do. So wherever you are today, I encourage you, if you've been on the fence about doing something, if you said, well, tomorrow's the day. No, today is the day. Today is the day for you to act up and do something. Today is the day for you to contribute towards your community and say, I'm going to put my foot down. I'm going to fight to reduce stigma, to raise awareness, and to fight HIV/AIDS. I put it on you. Come join me. Fight with me. Fight with others who are fighting this fight. And together we can affect some real change. We can't do it without you. I can't do it without you. So I would like to hear your thoughts on the healthcare reform. I'd also like to hear what difficult choices you've had to make in regards to your own treatment and HIV in your own life. And as always, please share my video throughout your networks so that we can get the word spread around. I hope all of you are well. Until my next video next week, do something positive.